welcome to a thought-provoking episode of the Pause and Effect podcast. I'm Dr. Kara, your host, and today we are diving into a vital aspect of a pet's well-being, their heart health. Joining us is Dr. Pieter Hanekom, an experienced veterinarian and the head vet of Hillcrest Veterinary Hospital in KZN, with a special interest in cardiology. Dr. Hanekom, thank you for being here. Today's discussion goes beyond the routine pet healthcare. It's about understanding the heartbeat of our companions and the nuances with cardiovascular health. Welcome, Dr. Pieter Hanekom. Thank you so much for being here today.
Thank you.
It's very, what a privilege we have to have you here, because there's a great wealth of knowledge that I sometimes have the ability to tap into, but
thank you.
It's not always good when we pass our cases on to you, because generally they have issues with their heart, and that's our subject for today.
Yeah, that's my favorite subject.
Yeah. So how did you get an interest in cardiology?
Well, I was thinking about it, and I think it goes back to my student days, which is a long time ago now. We had a really good lecturer in cardiology, and I think my interest was piqued even then. And then about 15 years ago, when ultrasound became mainstream in veterinary practice, I started doing the cardiac ultrasounds. And by the way, cardiac ultrasound is really, really important in the correct and early diagnosis of heart disease in small animals. I found I really enjoyed it, and when you enjoy something, it's easy to stay motivated.
Absolutely. And I mean, it's a great interest, because it affects our pets and our companion animals from early to sort of senior years. So I want to take our listeners on a bit of a journey and start with, that first puppy consult where you hear that murmur. And I think a lot of people think that it's an old age issue, or it's a breed specific thing. And I'm sure we'll get into those kind of conversations. But, that the importance of that first visit that can pick up a cardiac problem. So can you?
Yeah. So specifically with puppies, at the first visit, the veterinarian may pick up something called a murmur. So a murmur just refers to a kind of whooshing sound, which is not normal for the heart, and usually that's going to be as a result of a leaky valve or maybe a hole somewhere in the heart. And so those are then termed congenital defects, so defects that they are born with. Now, some puppies may have a murmur, and it may mean nothing at all, so we won't generally necessarily at that point be too concerned. But if it stays and they come for their follow-up visit and it's still there, then we start getting worried that there may be something in the line of a congenital defect, and then we would definitely want to have a look at it with the ultrasound to see what's going on. So that's something that's definitely maybe picked up by the first veterinarian who examines that pet.
So they notice that there's a abnormal sound. And are there any other clinical signs? Are there any other symptoms that
there may or may not be? Some of them are completely normal. In fact, most of the ones that I see, the first sign of a possible problem at that point is the abnormal sound, the murmur. But they may not necessarily show anything. But then there are those other ones where you might have a clue that something else is going on, because they might be the runt of the litter and they're a lot smaller than the other ones and they haven't been growing properly. Or they may already show getting tired very easily, or even having fainting spells. That sort of thing could already be present.
Mm-hmm. I suppose it's a good opportunity to go right into the thick of it and say, in terms of if your pet has cardiac issue, what are the typical signs that you would notice as a pet owner? Age, independent of age. What are the typical clinical signs?
Right. So for cats, and it's very different between cats and dogs, actually. In cats, the situation is rather difficult, because cats are very, very good at hiding that there's something wrong with them. And so they often have heart disease without anybody knowing about it until they have a sudden cardiac event, and that usually is going to be fluid that develops in the lungs or outside the lungs in the thoracic cavity, and then they're going to develop severe breathing issues. I say severe, it could even be mild sometimes, and if you're a good owner, you might pick up on that, but often it's picked up when it's already severe and they're battling to breathe, or they may have thrown a clot, which is a complication of cat heart disease, in which they can come in being paralyzed in the hind legs or even the front legs sometimes. So in cats, the situation is tricky. A lot of people will not pick up on anything unless you're really, really good observant owner. And you might find, oh, why are we breathing a little bit faster than what's normal?
And people, I suppose, attribute that to various other things. Stress,
yeah, they might
heat.
think it's unrelated. They may not make a connection at all. And then for the smaller dogs, though, they may usually it's going to be when they get a bit older, middle-aged or older, and they develop valve disease and leaky valves. And you might notice things like reduced tolerance to exercise, excessive panting, coughing, and sometimes also even fainting spells in those guys. Weight loss could be a non-specific sign too. And then in bigger dogs, they tend to have a different kind of heart disease called dilated cardiomyopathy, where the heart just becomes big and flabby and doesn't contract properly. And those guys, they usually will have episodes of collapsing as the most common sign.
And so in terms of, are there any breeds that are predisposed to these cardiac
Yes, definitely.
diseases?
So cats, again, for cats, it's proven that there's a genetically transmitted predisposition to certain types of heart disease in Maine Coon cats, ragdoll, a few other breeds. It's been proven, but probably most of cardiac disease in cats is actually hereditary or genetic. And in dogs, smaller dogs, as I said, get the valve disease. Actually, nobody knows what causes that, although, again, it has been genetically linked in certain breeds. And it's usually the small breed dogs. Any small breed dogs are predisposed. But again, spaniels as a medium breed can also get it. Sometimes larger dogs too. And for large dogs with dilated cardiomyopathy, it's going to be usually the Dobermans, Great Danes, Irish Wolfhounds. They are definitely predisposed.
And does that affect the crossbreeds of those?
The pure breeds are more affected, but for those, any large, especially male dogs, they're at risk, but those particular breeds are just definitely an increased risk.
So you take your dog in for its yearly vaccination, and someone like me will go, oh, I hear a murmur. Now, we are very fortunate that we have you in the practice to say, I'm just going to refer this case onto my colleagues so that we can work up this case. So my question to you is, how important is it to work up these cases rather than just make note of it and leave it? How necessary is a workup?
So again, we'll separate cats and dogs. So cats, if you bring your cat for whatever reason and your veterinarian picks up a heart murmur, that is almost always going to be significant and always has to be investigated. Saying that, about 20% of cats can have heart murmurs, and when you go and look at them and you examine them, you do your scanning studies or x-rays, whatever you want to do there, may have no evidence of heart disease. And about 50% of cats that have heart disease have no heart murmur. So cats, as animals, as usual, makes it very difficult for us veterinarians. In dogs, the situation is maybe a little bit easier. With smaller dogs with the valve disease, you should pick up a significant murmur. Very soft murmurs are probably insignificant. So it's a little bit subjective because not everybody's going to classify a murmur to the same intensity as somebody else. But a murmur that is anything more than very soft should be investigated.
And do they become progressive? Do they become do murmurs go from that sort of soft to loud?
Yeah, so usually if we talk about valve disease in small dogs, yes, as time goes by, the heart disease is going to progress.
Okay.
So the murmur already tells us that there is some turbulent blood flow. But is it significant at that point? That's what we need to determine. So, but it will progress. Some small dogs will have a murmur all their life and never go into heart failure as such. But there are a significant proportion of them that will progress and eventually end up in heart failure.
So a heart murmur is not an indication that your animal is in heart failure.
No.
So where is the distinction made between a turbulent murmur and one that is now ultimately, when we talk about failure, obviously that's indicating that it's irreversible changes.
Yeah. So heart failure is when you start seeing symptoms of heart disease. So you may have heart disease and it's not yet at the point of heart failure. In other words, there are no symptoms associated with it. It's already there. And it may progress, but there are no symptoms whatsoever. And so those are the guys that, and this is something that's changed over the last few years. It used to be a situation where us veterinarians would have said, oh, well, your dog's got a murmur, and you would ask the owner some questions as to, are there any symptoms? And if they say no, then you would say, okay, just watch out for these things for me and wait and see. And that's something that's changed because a few years ago, a really big study came out called the EPIC study, and the study showed that even if they show no symptoms at this point, and we're talking about valve disease, even if they show no symptoms, if they fulfill certain criteria, they could already start on medication, in particular a medication called pimobendan. And this medication has been shown to delay the onset of heart failure, i.e. the start of symptoms, by on average 15 months.
Wow.
And it's fairly significant because once they are in heart failure, they don't live all that long. The average there, if they're already in heart failure, is going to be about a year.
Cool.
All right.
So you really want to delay the onset of the secondary...
So it's very significant to be able to delay the onset of heart failure. And for some dogs, it's a lot longer than 15 months. So the average is 15 months, but for some of them, it's actually even longer than 15 months.
Wow.
So there's been a real change in the way that we look at it and that we decide as to when we start treatment or not.
So it's really advice to owners that rather than just like it being noted and to wait for those clinical signs to develop, to actually be proactive about it and to potentially start, depending obviously on what you find in your workup. Before we proceed, let's discuss a vital aspect of feline care, catering to senior cats' needs. Allow me to introduce UltraPet's Optimal Balance Senior Cat Food, meticulously crafted to meet the unique needs of aging feline companions. This specialized formula features a balanced blend of nutrients, including 34% protein, 12% fat, and 4% fiber, ensuring your senior cat receives the optimal nutrition as they age. With a delectable chicken and rice flavor, UltraPet ensures that even the most discerning senior cats will enjoy their meals. Plus, the vacuum-coated kibbles deliver a taste experience that will keep your cat coming back for more. What sets the senior cat food apart is its thoughtful formulation. With added taurine to promote good eyesight and healthy cardiac activity, your aging companion can enjoy their golden years with vitality. Made with fresh meat, this food provides a better source of healthy protein, while essential vitamins and minerals from VitaCat supports overall health, body function, and immune system protection. For ongoing dental health, the inclusion of calcium and phosphorus help protect your senior cat's teeth. Plus, the optimal mix of omega-3 and 6 fatty acids support a shiny coat and a healthy skin. UltraPet's Optimal Balance Senior Cat Food is available in 2 kgs and 4 gauge G-packs, providing the perfect solution for senior cats transitioning into their golden years. Give it a try and ensure your senior companion enjoys a healthier and more active life. Your pet will thank you, and you'll appreciate UltraPet's dedication to feline well-being. Now, let's return to our conversation.
Yes.
So let's talk about the workup itself.
Yes.
So just so that listeners can have an indication of the steps, because a lot of the stuff happens behind the scenes. So you hear a heart murmur. What are the sort of things that you would do while you're in the consult room in terms of like heart rates and respiratory rates? What are the kind of things that you pick up in a clinical examination? What are the things that you need further diagnostics for?
If we hear the murmur, then we want to roughly classify its intensity. And we will look at the breathing rate as well. An obvious too fast breathing rate, even in the consult room, if they're a bit anxious, can be an indication that we may have fluid buildup on the lungs. And from that point, we really want to do an X-ray as the first step. So an X-ray can give us an overview of the chest, the heart size, and if there are changes in the lungs, are we getting some fluid buildup in the lung secondary to possible heart failure. And then we want to do the ultrasound, because then with the ultrasound we can in detail look at the heart, the different chambers, the valves themselves, if they're leaky or they're not leaky, and we can get an idea of where we are in that process of heart disease. With cats, again, a little bit different, because with cats, as I said, they often present when they're already in a heart failure, having a heart failure episode. So for those guys, we will do the same process. We'll do the X-ray and ultrasound. Sometimes it's actually not that easy with cats to know for sure if it's heart disease or not when you just see them. So there's some nice little blood tests as well for cats that one can do to actually give you an idea if this cat comes in with severe breathing issues. You can do this little blood test. It will tell you the heart may be involved or probably not involved. You need to think about other reasons why there's, say, fluid in the chest, for example. So I use that quite often just to help as a first line things with cats that come in with breathing difficulties. And we still want to ultrasound them ultimately. We have to do that's the only way ultimately that we can say for sure.
And in terms of if you have a fractious cat, I mean, can you, an X-ray, obviously they lie still and it's taken very quickly, but are you able to sedate when you're trying to make these sort of assessments? Does it impact the results that you get in terms of heart rate and rhythm?
Yeah, so we always try to do without sedation, but there are some patients where you have to use some sedation. And yes, you have to be a little bit careful about which drugs you use. Some drugs can definitely affect what you're going to see on ultrasound, and when you start making measurements, it can affect those measurements, and then you don't know what to do with those results. So there are certain drugs, medications we can use to do sedation that will not interfere or interfere very little with whatever we're going to see. So yes, we have to do that sometimes.
I think the other thing to make mention of, only because we're presenting this to pet owners, is to make people aware that they need to be quite extensively shaved on the chest. And I think owners, probably this is the most traumatic thing for pet owners, is that in order to get contact with the probe and the chest, that they obviously have a layer of hair that you need to remove. I think that's probably the most distressing thing for owners when you're trying to inform them that they're going to have a cardiac scan.
Yes, I must say I do forget sometimes to tell, because I'm so used to doing it, so I forget to tell them up front, I'm sorry, but we're going to have to clip a little patch of hair.
Little window.
A little window of hair. But saying that, I myself had to go to the cardiologist not too long ago, and they put a Holter monitor on me, and in order to do that, they have to put all the little electrodes on your chest, and she pulled out her little clippers and
were you horrified?
Clipping some hair on my chest, and because as I'm getting older, I'm getting more hair there. I don't know why. and I kind of joked with her and said, "Well, at least I'm not going to be an orangutan anymore." And she's jokingly said to me, "You won't believe what I've seen."
So, at least you don't have to display your chest.
Yeah, this is nothing. She said, you won't believe what I've seen.
So obviously, having gone through the same, are a lot of the things very similar for people who have had family members that have suffered from cardiac disease? Are there any correlations between heart disease in people and the way things present, or are they a bit like cats and dogs being so different?
Yeah, it's quite different as far as I know. I mean, I don't know too much about human cardiology, but I think the thickened heart muscle, what we call a hypertrophic cardiomyopathy, is probably the most common heart disease in humans, as far as I understand. And that is something that we really only see in cats and very rarely in dogs. So yeah, there's definitely differences between with cats and dogs in particular, and then I suppose in humans it's not something I would want to comment on too much.
So let's go just so that listeners can get an understanding. Obviously, the heart is an organ, different diseases in terms of impacting the way in which it's working. But the primary role of the heart is to pump blood around the body. And obviously, if it's not contracting like it should, or it's leaking, you're going to get secondary consequences. And one of the things you mentioned was fainting, the collapse. We've had owners come in and say, "Oh, my dog collapsed," and sometimes I've found it quite difficult to get an understanding of is this a true syncope, a episode of collapse due to heart, or is it a seizure, particularly when they're slightly younger? So what are the sort of things that you ask in terms of trying to establish the difference between a collapse because of heart and an episode, a neurological event?
Sometimes it can be tricky because it's not always easy, because you're usually reliant on the owner to describe this event to you. You're not seeing it yourself. So it can be difficult sometimes because people don't always know how to describe what they've seen. So very often they would say the dog had a fit. But seizures or fits tend to be, you should have some muscle activity taking place. You should have some jerking or shaking or trembling. And with dogs that faint, that's not usually the case. They really just keel over and lie quietly for a minute or two and then regain consciousness and start getting up. They may make a howl or a cry, or they may urinate or defecate when that's happening, but there isn't usually any kind of muscle activity when that's happening. So it happens really because there's a shortage of oxygen getting to the brain, and this is like a shut-off mechanism for the body. Maybe like a kind of protection mechanism even, is to shut everything down because you're not getting enough blood to your brain. Your brain is the most important organ that you've got. So it's a shut-off mechanism to say, look, let's protect the brain here, and everything else just stops so that we conserve or get as much blood as we can to the brain to deliver that oxygen.
So some of the consequences, obviously the fainting, let's talk about the cough. So I want to explain how I understand it, and I want you to correct me if I'm wrong, because that's what we're learning from you in terms of cardiology. So from my understanding, the cough can be due to, like you said before, the accumulation of fluid, as well as the general size of the heart setting off the receptors within the chest. And that is where it's useful, particularly for vets who don't have the ability to do a cardiac scan, to take a look and see the size of the heart. Is that right? And the elevation of the
airways inside the chest. Yeah, no, you're quite right. So certainly just enlargement of the heart can push on the surrounding tissue, can push on the surrounding airways and cause a physical irritation. And so they may cough from that even if they have no fluid accumulation on the lungs. So it can be a combination of the two or one or the other.
Okay.
Interestingly enough, as a side point, cats, we mentioned coughing as a possible sign of heart failure in dogs, especially the smaller dogs. Cats don't.
They don't cough.
Cats do not cough. Very, very rarely would coughing be a sign of heart disease in cats. So that's another big difference between cats and dogs.
Sure. And by the time they've got things like coughing or accumulation of fluid in their lungs, are we talking, we obviously say they're in cardiac failure. Are a lot of those things reversible? I mean, is there any way of managing the size, and was this really the beginning of the end?
Yeah, so we'll separate cats and dogs again. So for cats, it's usually serious, and we've already got a big problem because they're already in heart failure, or they may have thrown a clot, which is usually very serious.
So can we go down that path just before you answer this question? So throwing the clot, why does that happen?
All right, yeah. So because of the blood flow, so the blood flow is now turbulent and not normal in the heart itself, and you've got some stasis of blood in certain areas, and the blood needs to flow continuously for clots not to form, if I can put it that way. So if there's any blood that's not flowing properly, not linearly, then there's a risk of clot formation. And for some reason, cats are more prone to this than dogs. And so this clot forms in the heart, and it can then leave the heart through the aorta, and it usually will travel down the aorta. Most commonly, it's going to lodge right at the back where the aorta bifurcates and goes down to the hind legs, the left and right. and they will then be acutely paralyzed in the hind legs. Occasionally, if the clot's smaller, it could go down to the front leg, and you might have a suddenly paralyzed front leg because the blood supply has been cut off.
And this is dreadful.
That is very bad news.
That
is very, very bad news. And unfortunately, most of those guys, we end up euthanizing because there's no real treatment that you can give them that's going to make the clot go away.
We've tried.
You can give them medication to try and stop new clots from forming, but the clot is already there. Unless it's maybe if it's a front limb, maybe because it's a smaller clot, we might give it some time to see what happens. But with hind legs, it's usually the end of the road, unfortunately for those
And often,
guys.
as vets, we're obviously feeling for it. It's shown by them being paralyzed, but they have cold extremities and often sore. It's like that pins and needles feeling, isn't it?
Yeah, especially initially, it appears to be very painful, and then maybe a day or two later, it doesn't seem to be painful anymore because the blood supply has been cut off. But yeah, you will have no pulses when you try and feel for pulse in that leg. You'll feel no pulse. It'll feel cold to the touch and so on. Yeah.
It's dreadful. Sorry to digress. So we're talking cats. Like, is it the end?
Yeah. But if you can treat the guys who have fluid accumulations in the lungs or outside the lungs, in the chest, and various medications we use depending on at what stage they are. So cats also may have an episode. They might have a bad episode. Cats are creatures of habit and they stress out very easily. So you might have a cat that's completely normal and it comes into the clinic and it may have another procedure for something totally unrelated, and perhaps 2, 3, 4 days later it's in heart failure. And that's because it's already had heart disease all this time and nobody knew about it. Even on examining it, we didn't find anything, but the stress of the hospital visit pushed it just over the edge and it's now in heart failure. So those guys, sometimes if you start treating them, you can quite successfully treat them and keep them going for quite long periods of time. But each one's going to be different and you just don't know how it's going to go. And for dogs, there's the smaller dogs with their mitral valve disease. They can be treated quite successfully in that we can help that heart to cope better. We can't undo what's going on. We can't change the leaky valves. We can't cure it in any way. It's going to be a lifelong disease and chronic medication for the rest of their lives. But saying that we can treat them quite successfully for quite long periods of time, up to a few years sometimes, they can still live a pretty decent and normal life.
Good quality as well.
Good quality life, yeah. And for the bigger dogs with their dilated cardiomyopathy, up until a few years ago, it was a very, very serious diagnosis and still is, because some don't do well, but a lot of them now do much better and can live a lot longer since the advent of this drug I mentioned called pimobendan, which helps the heart to contract stronger. It does a few other things too, but primarily helps the heart to contract stronger. And so for those guys, this drug has been almost magical, I would say, because before I would say if you see one of these guys that come in, they've collapsed, you diagnose them with dilated cardiomyopathy, you'd say maybe they've got a couple of months to live.
Sure.
And now we've had some of these guys that are still carrying on after a year or 2 years.
And how difficult is it to manage heart disease with other comorbidities? So, I'm talking geriatric patients. How often do you find that they're not necessarily struggling, they're not dying or become progressively sort of worse because of the cardiac issue, but because they're often with older dogs, there are other issues that, what are the conditions that you see simultaneously in these cases?
Yeah, it can be tricky sometimes because older animals they may have multiple issues. They may have kidney disease as well, which is a common one. Liver disease. They may have cancer. They may have osteoarthritis. So sometimes it is tricky to balance all these things out and decide which medications you may want to use or what dosages you may want to use. You might want to change some of those things. you might want to look at the diet as well. For cardiac disease as such, the most important thing about diet is just that it's a well balanced and a very calorie dense diet, because they tend to lose weight. And then when I say balance, you've got to make sure that in particular your amino acid levels are there. Certain amino acids, or deficiency in certain amino acids, can contribute to heart disease.
Is that in particular taurine?
Taurine and carnitine are the two, yeah. But then you've got to keep in mind that if they have, say, kidney disease, they may need to be on a special diet for their kidney disease. So sometimes it's a bit of a balancing act, but we make plans.
So it's really it's really working with owners, both in terms of their financial means, because this is not. My next question was going to be like how prohibitive are the costs of these drugs, or even the cost of the workup, and then it comes down to making recommendations on good quality. So can I start first with the term you said? A lot of these cardiac patients have weight loss, or cardiac cachexia. So what is that term? Why are they losing weight when they have heart disease?
Why are they losing weight? Yeah, I don't really know why they're losing weight. It's a well-known thing, and as you said, it's termed cardiac cachexia. That it's associated or sometimes associated with heart failure, that you have this loss in weight and loss in muscle mass. But actually, I don't know what the direct connection is.
Maybe the exertion. Hey, I don't know. That'll be an interesting one for us to. And then in terms of the cost and the prohibitive costs of some of these drugs, obviously in large breeds, it's sort of dose dependent. How many people are limited by sort of financial?
It can be quite a big factor, Not so much for the smaller doggies, because as you mentioned, everything is dosages are based on body weight. So, but if you've got a Great Dane and it's got dilated cardiomyopathy, those medications are going to cost a fair amount of money. Rough guess right now, maybe 2,000 rand a month or something like that to treat one of those guys. So it's significant. And yes, also we talked about the diagnostics earlier on, and yes, there are clients who say, look, I can't afford all these diagnostic tests. You can take an X-ray, but I really can't afford the scan. So from our point of view, that's never ideal, because we don't get all the information that we really need. But we've got to work around it sometimes. And if people say, look, I can only afford this much, and we make plans and we work around it, and we may have to make some educated guesses sometimes, because we don't have all the information. But yes, it is a reality that people don't always have the funds to do the full cardiac workup, and they may not have the funds to treat either. It is a reality, yes.
Particularly, I suppose when we see them in emergency cases, so those ones that tip over and come in and you realize it's a cardiac case, but in an emergency type situation, it's obviously after hours and they collapsed, or they're needing fluid drained from their chest or whatever, and then you go to the workup that there's already a big amount spent in trying to stabilize them. So sort of being aware of the kind of signs to look out for is really helpful, I think, for owners to be able to say, I think there may be an issue here. And a lot of the things are common signs of other conditions, so it's better to have a vet rule out, if not diagnose.
No, definitely. It's definitely needed. Ultimately, it's always going to be the owner's decision how they want to manage the process. But at least our aim is to get the information and say, well, this is what's going on, this is what you can expect, this is what we need to do, and then it's up to the owner, the client, to make the decisions.
So how regularly, when do you ask for these patients to come back? So how often are you wanting to connect with owners and re-examine their pets to say, I need to follow up and see how well they're doing on the medication, whether they've got to be any alterations in what you're doing?
Yeah, so normally we'll if we're going to treat, we'll start a treatment, and I will usually ask them to come back fairly soon, maybe 2 or 3 weeks later. Obviously, if there are any worries, they must contact us. But otherwise, 2 or 3 weeks later will be the first check, and then depending on how they're doing, we might want to adjust medication. We may want to change some things. And if they're doing well, especially with small dogs, which, by the way, small dogs with mitral valve disease form about 75% of all heart disease in dogs. So that's by far the most common thing we see, and luckily that's also the easiest one to treat. So those guys, if they're doing well after the first return visit, then I might say to only look at them once every 3 to 6 months. And as long as the owners are observant. One little test I always give them is the sleeping or resting respiratory rate. So
Okay.
what that refers to really is how fast are we breathing when we're resting or sleeping. And I always ask owners to do this for me on a regular basis. What we're looking for, or what we would be concerned about, is if the sleeping or resting respiratory rate, breathing rate, is creeping up.
So they've got a normal, they establish a normal, and then it's based on that?
Yeah.
Or
So
do
in
you
fact,
set
normal dogs are around about maybe 12 or 15 breaths per minute. And up to 30 can be a grayish area, but certainly if we get up to 30 or beyond, we know that we're not doing well.
And the other signs, obviously, to watch out for, hopefully owners notice from the advice you're giving them, but the stand, like a different posture in order to breathe, or the coughing or the collapse. I mean, those are quite
the obviously bad signs of heart failure, which we mentioned before. Any of those things would be a major concern. Unfortunately, it is a fact that even with those small doggies with the valve disease, they eventually do progress, and you reach a point where medication just doesn't help them any longer. Okay. And their quality of life is at that point such that they cannot live without the medication at all. And even on the medication, they may battle to breathe properly and so on. And then at that point, one has to make the decision to maybe let them go. Saying that, for a lot of these patients that I see, there may be something else that causes their eventual demise before the heart disease catches up with them.
I mean, that's how good the sort of treatment can be now, that heart failure is not necessarily the reason why they're put to sleep. That
exactly.
Something else
it could be something else.
Yeah. So this is a manageable, so it's not doom and gloom. It is something that if owners are wanting to be proactive or in a position to be proactive about, can give them an extended period of time with their dogs, and obviously finance dependent, can allow their dogs to lead good quality life.
Yes, so there definitely is. For most of them, there's treatment, and the treatment can really help them. It is going to be lifelong. It is going to be chronic meds, but it is there and it can help them. And just as a side point on treating, interestingly enough, there is some surgery that's being done in other parts of the world for these little guys with the valve disease, whereby they actually do open heart surgery and they repair the little cords that attach the valve to the side of the wall of the heart, because those cords often become broken or stretched, and they actually replace those little cords surgically, and they've had really, really good success. Basically, that's a curative surgery, and they have a very high success rate. But the trouble with it is it's only available in a couple of spots around the world. It's in fact a Japanese cardiologist who developed this technique, and it's very, very expensive to do. The latest figure I've heard was like $45,000 US.
Wow.
And there's a waiting list, believe it or not.
That's incredible.
I don't think it will easily come to South Africa. It will easily be available in South Africa.
Offering it in our practice.
Yeah.
In the near
and then I think there's some research being done on using some stem cell therapy as well, being looked into. So hopefully, going into the future, we may even have more options to help these guys.
And maybe sort of like you were describing the blood test, sort of additional aids for vets who don't necessarily have the ability to scan or do cardiac ultrasound, so that first protocol in terms of early diagnosis.
There may be some tests coming on board that can help as well. So new treatments, hopefully. As I said, we mentioned pimobendan before, which has been a really big bonus for treating most kinds of heart disease. And there might be new things too. I mean, before that, we used the same medication for 50 plus years. And so something new came along and it's made a big difference. So there's always the hope that there might be new medications on the horizon, and then all these other things that we remain hopeful.
It's a fascinating subject. I see why you're passionate about it. And I'm really grateful for the information that you provided, both me and hopefully the listeners. And thank you very much for taking the time today to come and discuss your favorite subject.
Thank you for inviting me to be here. Yes, and I always enjoy talking about cardiology.
Yeah, no, I know. Any opportunity to discuss your favorite subject. So I'm really grateful because I think I've learned a few things.
Thank you.
So thanks. Wrapping up our conversation with Dr. Pieter Hanekom, we have uncovered layers of insight into the world of cardiac health in our pets and unpacked some complex terminology. This isn't just another veterinary topic, it's an essential dimension of pet care that demands our attention. Dr. Hanekom, your expertise have provided a valuable perspective, promoting us to consider our pets' heart health with newfound awareness. To our listeners, share this episode with fellow pet enthusiasts because informed pet care is the best care. I'm Dr. Cara, signing off until our next episode. Take care of yourself, and please don't forget to give your pets a big hug from me. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at drcara@pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.